We're really honored to have Tavenner Dibert here, who is a pediatric cardiologist, and she starts her cardiac intensive role in the summer. She's also the head of the Neonatal and Pediatric education system for ELSO. So, we're really going to have somebody here who, when they say they know what they're doing with the education, they really do know what they're doing with the education because she runs it. So would you please welcome Tavenner Dibert.
Thank you very much for having me here today. It's an honor to be here talking to you all about updates in neonatal and pediatric ECMO education. So I would just like to get started by talking about the original idea for standardized ECMO education, which is really the heart of this project. And back in 2019, the ELSO Education Task Force published a position paper focused on describing the state of ECMO education worldwide. And they noted that there was significant variability and limitations in global ECMO education. And additionally, they noted that even though ECMO was increasing in its use and more healthcare providers were becoming familiar with it, the rate of complications was not decreasing. So the ELSO Ed Task Force put forth an educational agenda regarding opportunities for a collaborative approach towards standardization of ECMO education worldwide. And noted in this work was the need for the organization of an international and multidisciplinary expert group that could develop an ECMO curriculum by incorporating both the ECMO knowledge as well as the psychomotor skills. And in 2020, the Extracorporeal Life Support Organization, otherwise known as ELSO, launched the culmination of this work for the adult ECMO population with the release of ECMO Foundations, the ELSO Adult ECMO Core Curriculum, and the ELSO Adult ECMO Certification Exam. And from this course, ideas began to emerge for other areas of need in neonatal, pediatric, and ECMO education, particularly the need for standardized neonatal and pediatric ECMO education. So some people may say that children are just small adults, but there's a lot more complexity that goes into it than that. So some of the challenges specific to neonates and pediatrics, just to name a few, of course, are the size of the patient, choosing the appropriate cannula size for your patient, whether it's an infant or a child or an adolescent. The cannula location, where can you cannulate an infant versus an adolescent patient? Priming a circuit, using blood priming, especially in tiny patients, in order to prevent hemodilution, and appropriate flow for your patient. What's an appropriate flow for a 3-kilogram infant versus an adult-sized adolescent patient? And then what's more, with congenital abnormalities as well, specifically patients with congenital heart disease, what is the appropriate flow for a single ventricle patient versus a patient with 2 working ventricles? And what is the change in your ECMO management for an infant with hypoplastic left heart who's undergone a Norwood with a BTT shunt versus an adolescent with a Fontan? So obviously there's a lot of great complexity with those things, and not to mention, of course, other congenital abnormalities such as congenital diaphragmatic hernia. And when is it appropriate to put those patients on ECMO? What kind of ECMO should they be on? When should they have their surgery? And what are the most recent guidelines saying for all of those types of things? So in the summer of 2022, the ELSO Neonatal and Pediatric ECMO Foundation's Curriculum Task Force came together to start working on this project in hopes of overall improving neonatal and pediatric ECMO education worldwide. Ultimately, we hope to create a comprehensive course with a goal of providing standardized ECMO education to healthcare providers all over the world with all varieties of skill sets. This would include nurses, surgeons, intensivists, respiratory therapists, perfusionists. Really, essentially, this would be a course for each and every member of the ECMO patient's healthcare team. And this course would be online and self-paced. Learners could sign up to take the course at any time, and they could complete it as quickly as they would want. The curriculum content would include a variety of topics, including the history of ECMO, what comprises an ECMO circuit, cannulation strategies, ECMO physiology, indications for ECMO, how to manage patients with congenital abnormalities, such as congenital heart disease, troubleshooting an ECMO circuit, and much, much more. We anticipated that the course would likely be comprised of over 60 modules, 60 modules, and would be based on over 100 learning objectives. And our goal would be that once the learners have completed this online didactic course, that they could take a knowledge assessment and simulation testing. And then once the learner had earned a passing score on these forms of evaluation, they would ultimately be also certified in neonatal and pediatric ECMO education and care. So as you can see, this is a 3-step program that has ultimately been modeled after the adult course. So here we can see essentially how the adult course is structured, and we modeled our neonatal and pediatric course to be similar. Ultimately, it was step 1 being a didactic course, step 2 being an in-person simulation lab for psychomotor evaluation, and step 3 being documented clinical bedside experience. And then once learners had completed this 3-step process, they would be eligible for neonatal and pediatric ECMO certification. So as you can tell, this is a rigorous course in order to ensure validity and certification, essentially so that hiring bodies can be sure that when they're hiring a healthcare provider who is also certified in neonatal and pediatric ECMO, that they know this healthcare provider has not only mastered the basic concepts of ECMO management, but can be an active member in the ECMO patients management team. So ultimately, we hope to create a curriculum that is reliable worldwide and meets the ELSO educational standard via this 3-phase approach that you can see here, which includes content creation and review, building a curriculum, and building a consensus via an expert panel. ELSO's curriculum and knowledge assessment development methodology is rooted in academic medicine, education theory, practice, and research. And each of these elements strengthens and enhances our approach. So as we all know, ELSO has used clinical research, literature, and guidelines in the creation of the Red Book, which is ultimately the definitive reference text for extracorporeal life support, written by over 200 experts from around the world. With this incredible amount of data and literature, our team has been able to start the 2nd phase of developing and building a curriculum. So even though we have the guidelines and literature to build an excellent curriculum, we want to make sure that the content we are creating is applicable to healthcare providers worldwide. And as we said, we want this curriculum to span numerous types of skill sets. And this is what brings us to the process of obtaining consensus through what is called the Delphi method. Ultimately, I'm sorry, I think something might be wrong with my mouse. Here we go. So ultimately, the Delphi method is an educational process model used to reach an expert group consensus on a prioritized set of learning objectives. So in other words, we identify an expert panel, and we ask this panel to essentially review the learning objectives that we have come together as a group to feel are most critical for our learners to know. And then the experts review those until consensus is reached, or in other words, until all of the experts have agreed on the most important objectives that should be included in the curriculum and the course. Our expert panel was composed of pediatric cardiothoracic surgeons, pediatric surgeons, neonatologists, pediatric cardiac intensivists, pediatric intensivists, nurse ECMO specialists, RT specialists, and perfusionists. And they were from all over the world. So we made sure that our experts were from all 5 of ELSO's chapters. In terms of the course development process, the Neonatal and Pediatric Foundations team identified over 170 learning objectives that we felt were critical for a healthcare provider to understand when taking care of a patient on ECMO. These learning objectives were then sent to our expert panel via our phase 1 Delphi process. And from here, we established 150 official learning objectives that would be included in the course. These 150 learning objectives were then used to create a curriculum structure and overall curriculum backbone, from which 66 official modules were created. And at this point, the ELSO team has been working hard on our content creation and module finalization with an anticipated completion date of October of this year. So it's been a huge effort, and we've been very thankful for our expert panel and all of our authors. We have had authors from all over the world who have helped to create all of these modules. So it's really been a worldwide effort, and we're very grateful for all of the help that we've had from all over. And I want to highlight that this will be the first time that we'll have a global standardization for neonatal and pediatric ECMO education that will be for providers all over the world. As we said, this is a 3-step course, so there are other areas of education that we are focusing on. Of course, we said that we would also be developing a knowledge assessment and then a simulation course as well to go with that 3-step course that we talked about at the beginning. So in terms of our knowledge assessment creation, this was overall a similar process to what we did to create the official course. So we did a separate Delphi where we sent the same 170 learning objectives to our expert panel, and we asked them to identify the top 50 learning objectives that should be included in the knowledge assessment. And then from here, our knowledge assessment team began the process of writing questions based on those chosen learning objectives from our expert panel. At this point, the knowledge assessment is in the beta phase where it's being tested. Essentially, we have students who are taking the exam, and then from there, we determine which questions we'll keep on the official exam and which questions we will not be using, and overall with an anticipated completion date in the next couple of months, actually. So that will be done very soon. And here, this will be the first time that we'll have a validated knowledge assessment to allow for ECMO certification in this neonatal and pediatric population. Regarding simulation creation, this again has also undergone a similar process to that of the online didactic course and the knowledge assessment development. We again, for this, identified an expert panel, and then we sent them the scenarios that we thought were most critical for a healthcare provider to be able to be familiar with when taking care of a patient on ECMO. And so from there, we identified 7 scenarios that were the most critical and will be included in the simulation course. And the first simulation course to be offered based on these official neonatal and pediatric simulation scenarios will be offered this October, actually. So here I just included a timeline just showing all of kind of the work that's been done starting in July of 2022 when the Neonatal and Pediatric Foundations team first came together. And from there you can see phase 1 where we developed our core curriculum, ultimately doing our Delphi process, identifying those really important learning objectives that we wanted to include in our course. And then from there going into module creation and then ultimately module peer review for a hopeful end date of October of this year. In terms of the knowledge assessment, again, our phase 2 Delphi, for which we identified the most important learning objectives to be included in our exam, and then our phase 3 Delphi to create a simulation course. And then during this time as well, there have been some virtual courses offered and simulation courses offered as additionally. So here we are now in May, and everything should be done in October. So you can see where it started and where we are, so very close to the end, which is very exciting. So if you don't want to wait until October, there are some additional opportunities. In terms of the simulation, as we said, that course will be offered in October, so that's the soonest one. And as we said, this simulation course will be based on the official scenarios from our Delphi process. In terms of sooner courses, we are offering a virtual course in June, on June 3rd. Ultimately, students who do this course will have 29, will have access to 29 lectures that they can watch ahead of time. And then on June 3rd, we'll have a live case series and question and answer session. So if you don't want to wait till October, you can also sign up for the course in June. But most importantly, I would like to say thank you to all the incredible people who have helped in the creation of this course, especially Dr. Giles Peak, who has been my mentor throughout this process and helped me with this course. The incredible people at ELSO, Elizabeth Moore, Alex Fox, for all of their dedication, and then of course our Neonatal and Pediatrics Foundations team, our simulation team, knowledge assessment team, and expert panel, as we work hard to ultimately improve neonatal and pediatric ECMO education and care worldwide.